as a community of respect and pride, but it was a lesson in what we would be facing as we went forward. Elizabeth Taylor helped to break all of that down. She helped to break So here we are. What is the slogan? The numbers don't lie. It's time to end disparities. That is more than a theme. It's also a national challenge. And the leadership of President Obama and Douglas Brooks, who is here, Douglas Brooks, the director of the Office of National AIDS Policy. Douglas, for your leadership, along with strong partners such as Paul Kawada and NMAC, we are able to target resources and focus on the epidemic as it is now. African Americans account for almost half of the new infections. Latinos account for 21% of all new HIV infections. And young gay and bisexual boys and men aged 13 to 24 are infected with HIV at disproportionately high rates, especially young black men. The estimated rate of new HIV infections for African American women is 20 times that of white women and almost 5 times that of Latinos. That is totally, we have to get rid of all of it. But this disparity is a call to action. And what I'm excited about is that 5 years ago, President Obama unveiled America's first national plan to combat this devastating scourge. A national strategy, reducing the number of new infections, to reduce HIV health disparities, increase access to care, creating more coordinated national response, reviewing our progress, and being entrepreneurial. This last point is very important. I don't have it here, but I thought I did, but I don't have it here. But you could go to Dr. Francis Collins' website and see what he's just put up there recently. It will give you so much hope. And perhaps Dr. Fauci already spoke about it today. But I will just briefly say that it gives me hope. Katie, it gives me hope because what they're talking about is evaluating. What have we been doing the last at least 25, closer to 30 years in this regard? Let's take stock of the research, the care, the prevention, the search for a vaccine. Let's learn from the human body, the response that people have had to different therapies, and how the human body has an ability to almost cure itself. If we can synthesize how the human body does that, not just left to its own devices, but learning from it. And that vaccine could be such an answer, such a life-saving answer to throw away this thief that we call HIV/AIDS that takes away good health and life. Now, in those many years since Elizabeth Taylor testified, we have come a long way in terms of prevention, care, and research. We have, in my office once a month, we would have a meeting in the 90s, early 90s, we would have meetings of people with HIV/AIDS, and we would have workshops, and they'd want to know how to make out a will, and how do they this, and how to do that. Well, then within a few years, pretty soon those same people were coming back and saying, I need a job, and I want to move to another place, and it was a beautiful, beautiful transition. Yeah. The quality of life has certainly improved, and sustaining and maintaining life has improved. But what can we learn from those people who have improved their quality of their lives from their bodies? Go to Dr. Francis Collins' website. It's very encouraging.